Hello and welcome to your Harrisburg Area Community College Blended Learning EMR program. James Weber here. Give you a quick rundown on potential injuries to muscles and bones. Today's discussion, EMRs will encounter a lot of people who have musculoskeletal injuries, fractures, dislocations, sprains and strains, head injuries, spinal cord. There's just a bunch of them that we'll come across, right? And we have to know how to successfully treat these types of cases. Understanding basic anatomy and functioning, or the functionality of the musculoskeletal system, is really going to be a game changer on making sure that you're effective at treating these kinds of injuries, right? If you don't know the basic anatomy, you don't know the musculoskeletal system and how it works, you're really going to have trouble in, effectively treating these patients. You must be able to recognize signs and symptoms of various musculoskeletal injuries, and providing proper care at the scene really can prevent additional injury or disability. The skeletal system consists of 206 bones, right? That's a lot of bones. It acts as the supporting framework for the body. The functions of the skeletal system, right? To support the body, to protect vital structures, to assist in body movement, and to manufacture those important red blood cells. The skeletal system is divided into 7 areas: the head, the skull, the face, the spinal column, the shoulder girdle, the upper extremities, the rib cage, the pelvis, and the lower extremities. All important parts of the skeletal system. These are just some examples of the different parts, and it's going to be important to have an idea as to how that works. We'll make sure there's a little bit of additional learning on D2L about making sure that you're clear on the different parts of the skeletal system. The bones of the head include the skull and the lower jawbone. The skull is actually many bones fused together to form a hollow sphere that contains and protects the brain. The jawbone is a movable bone attached to the skull itself. The spine consists of a series of separate bones called the vertebrae. The primary support structure for the entire body. The spine has 5 sections: the cervical spine, the thoracic spine, the lumbar spine, the sacrum, and the coccyx. And this is just an example of how that lays out as you move from the top to the bottom of the spine in by sections. Each shoulder girdle supports an arm. It consists of a collarbone and a shoulder blade. The upper extremities consist of 3 major bones, plus of course the wrist and the hand, which includes a lot of little bones. The forearm has 1 bone. The forearm has 2 bones, the radius and the ulna, and the arm itself has 1 bone, which is the humerus. We have 12 sets of ribs to protect the lung, the spleen, the liver, the heart, and really that is kind of what gives us structure in the thorax. All of those ribs are attached to the spine itself, and the sternum is located in the front of the chest. The pelvis links the body in the upper and lower extremities, and the lower extremities consist of the thigh and the leg. The thigh bone, which is the femur, is the longest and strongest bone of the body. The leg consists of the tibia and the fibula, plus the ankle and the foot itself. The muscles of the body provide support and movement. Muscles are attached to bones by tendons that cause movement by alternately contracting and relaxing. Movement occurs at the joints, where 2 bones come together, and the bones are held together by ligaments. There are 3 types of muscles. Voluntary muscles are skeletal muscles, and they're attached to bones that can be contracted and relaxed by a person at will. These are the bones in which traditionally allow us movement, right? Involuntary muscles are smooth muscles, and they're found on the inside of the digestive tract and other internal organs. Those involuntary smooth muscles are what allows things like peristalsis to occur, which is the movement of food throughout the digestive tract. That's just one example. And the cardiac muscle, of course, the cardiac muscle is found, this should surprise you, in the heart, and it's found only in the heart. Just some examples of some of these muscles that we spoke of and how they work. You'll find some of these graphics actually in your book as well for reference. Mechanism of injury. Mechanism of injury really matters because it can give you an indication as to what's going on inside the body. Because I don't know about you, but I don't have X-ray vision. And man, in my EMS career, I wish I did. But because we don't have X-ray vision, we have to come and make a judgment call as to how bad the patient's injuries are. And it's difficult to do based solely off of what you see, because sometimes the larger and more substantive injury is what we don't see. It's the inside of the body, right? And a lot of times we have the ability to predict that by simply paying attention to the patient's mechanism of injury. Musculoskeletal injuries are caused by three types of mechanism: direct force, indirect force, and a twisting force. Use the information provided by the dispatcher en route to the call that's gathered from the scene to identify the possible mechanism of injury. There are many different ways to describe a patient's injuries. Use your senses of sight and your senses of touch. Listen to the information the patient gives you. And the most important part of your job is to really do a thorough assessment and provide the best treatment you can. Different types of injuries: fractures. Fracture is a broken bone. It most often occurs as a result of significant force. In closed fracture, the bone is broken and there's no break in the skin. In an open fracture, the bone is broken and the underlying skin is lacerated. Both do result in bleeding at the fracture site. It just looks a little different. Dislocations. A dislocation is a disruption that tears at the supporting ligament of the joint. The bone, it separates completely from each other, and when that separation occurs, it can lock in an individual position. Any attempt to move the dislocated joint can and often is very painful. A dislocation can damage nearby nerves and blood vessels. A sprain is a joint injury caused by excessive stretching of the supporting ligaments. A strain is caused by stretching and tearing of the muscle itself. Signs and symptoms of extremity injuries: pain at the injury site, an open wound, swelling and discoloration, the patient's inability or unwillingness to move the extremity, deformity, angulation, or tenderness at the injury site itself. Standard precautions for musculoskeletal injuries. Assume that a trauma patient have open wounds that pose a threat for infection. Often, that threat for infection can be some of the single worst issues we have, right? Single worst issues that we have for our trauma patients and their long-term outcomes, right? So we want to make sure that we're very careful around those open wounds. We want to cover them as quick as we can, and always wear gloves to protect yourself as well. When you respond to a motor vehicle crash, wear heavy rescue gloves, big, thick gloves to protect yourself. If a patient is active bleeding that may splatter, we should be using things to protect our eyes, nose, and mouth. So all treatment for musculoskeletal injuries. The limb injuries are treated in the same way in the field, kind of collectively. Cover the open wounds with a dry, sterile dressing. Apply firm but gentle pressure. Apply a cold pack and splint that injured limb. General principles of splinting. Advantages of splinting: prevents the movement of broken bone ends and a dislocated joint, but damaged soft tissues. It helps to control bleeding, decreases the risk of additional damage, and prevents closed fractures from becoming open fractures during movement or transport. Remove clothing from the injured limb to inspect for open wounds, deformity, swelling, bruising, or capillary refill. Note and record the pulse, the capillary refill, the sensation, the movement distal to the point of injury, and cover all open wounds with a dry, sterile dressing before applying that splint. That's pretty important, especially in the avoidance of potential infection. Do not move the patient before splinting unless there's immediate danger that you're trying to avoid. Immobilize the joint above and below the injury site itself. Pad all rigid splints and support the injury site by minimizing the movement of the limb until the splinting is completed. Make sure you splint that without moving it unnecessarily, and if you're not sure whether you should splint or not, go ahead and put a splint on. When it comes to injuries to the head, skull, or brain, these kinds of injuries are actually pretty common causes of death, right? This causes a pretty nasty, significant issue for the patient. So let's talk a little bit about some of the anatomy and physiology, right? The human skull, it has two primary parts, the cranium and the facial bones identified here. And the reason why we need to know that is some of them are removable, some of them aren't, and it's important we know kind of how a lot of these working parts function. Mechanism of injury really makes a difference with these types of patients, and understanding the anatomy and physiology will help make a lot of this mechanism make better sense, right? Between the skull and the brain is cerebrospinal fluid, and it cushions the brain. A direct force to the brain can injure the skull and brain. Indirect forces can also cause injury, but they're remarkably more difficult. Types of head injuries. In a closed head injury, bleeding and swelling within the skull may increase pressure on the brain, leading to damage and death. An open head injury usually bleeds profusely. Examine the nose, eyes, and the wound itself to see if there's any blood or CSF, which is cerebrospinal fluid. See if any of that's seeping out, because that's going to be a problem if it is. Brain tissue or bone may be visible for these types of injuries. These are just some examples of what the energy as it goes through the body will do during a brain injury. Signs and symptoms of head injuries, at least the most common ones: confusion, unusual behavior, unconsciousness, nausea, vomiting, blood from an ear. How about decreasing consciousness and unequal pupils? Paralysis, seizures, external head trauma. A serious head injury may also produce some darkening around your eyes, commonly referred to as raccoon's eyes, or battle signs. These are just some examples of that, right? These are just some examples of that. Treatment of head injuries. By the way, a lot of these pictures you're going to find when we talk about it, we're going to scoot through it, mostly because you're going to find a lot of these pictures directly out of your book as well. Treatment of head injuries. Immobilize the head in a neutral position. Maintain an open airway with a jaw thrust maneuver. Support the patient's breathing with oxygen. Monitor circulation. Be prepared to perform cardiopulmonary resuscitation if necessary. Treatment of head injuries. Determine whether blood or CSF is seeping from a wound or from the nose or ears. Control bleeding from the head wounds with dry sterile dressings. Examine and treat any other injuries that are serious. And of course, you really want to arrange for some significantly prompt transport to be able to get that person to a hospital pretty quickly, because these injuries are pretty life-changing, life-serious, and even life-threatening. Facial injuries commonly result in the following types of injuries: motor vehicle crashes where the patient hits the steering wheel with their face or the windshield, right? Assaults, falls. These are just some examples of things that will result in facial injuries. Airway obstruction is the primary danger for severe facial injuries. If a patient has some severe facial injury, suspect a spinal injury. Treatment of facial injuries: immobilize the head in a neutral position, maintain an open airway with the jaw thrust maneuver. Treatment of facial injuries: support breathing, monitor circulation, control bleeding by covering any wound with a dry, sterile dressing, and applying direct pressure. Look for and stabilize other serious injuries and arrange for prompt transport. Some examples of treatment for facial injuries, right? If they do not keep the airway clear, or if you're unable to control bleeding, log roll the patient onto their side. Mechanism of injury: any displaced vertebrae, swelling, or bleeding may put pressure on the spinal cord and damage it. In severe cases, that entire cord may be severed completely. Injury to the spinal cord high in the neck can actually paralyze the diaphragm and result in death. Gunshot wounds to the chest or abdomen may produce spinal cord injury at that level. Falls, motor vehicle crashes, and stabbings are other common mechanisms, although they don't always, and it's far less frequent, that those mechanisms will do significant damage to the spinal cord, at least as it relates to falls and stabbings, right? Suspect a spinal injury if a patient has sustained a high-energy traumatic event. Signs and symptoms of a spinal cord injury: laceration, bruise, other signs of injury to the head, neck, and spine, tenderness over any point on the spine or the neck, pain in the neck or the spine, or pain radiating to an extremity, or extremity weakness, numbness, paralysis, or any sort of loss of movement. Signs and symptoms: loss of sensation or movement or tingling, burning sensation in any part of the body below the neck, loss of bowel and bladder control. Place the head and the neck in the neutral position, stabilize the head and prevent movement of the neck. Maintain an open airway, support the patient's breathing by administering oxygen but keeping that airway open. Monitor circulation, assess the pulse, movement, and sensation in all of the extremities. Examine and treat other serious injuries. Immobilize the patient on a long or short backboard and arrange for prompt transportation. Motorcycle and sports helmets. They don't often they don't often need to be removed, right? Remove part of a helmet only under two specific circumstances. If it's so loose that you can't secure the spine, or if it interferes with your ability to actually manage the patient's airway, right? So if they need to ventilate it with a bag valve mask and the helmet's in the way, get the helmet off. We got to ventilate them. There's a couple of skill drills that are in the book that you get some practice with during our lab sessions. Fractures of the ribs. Even a simple fracture produces pain at the site and difficulty breathing. Rib fractures may be associated with injuries to the underlying organs. To determine whether a rib is bruised or broken, apply some gentle pressure to another part of the rib. Be alert for signs and symptoms of internal injury, especially shock. In order to treat this, the biggest way is to place a pillow against the injured ribs and to split them by actually securing that pillow to the patient's thoracic space. Fractures of the ribs. Prevent excessive movement of the patient and administer oxygen wherever you can. Flail chest. If 3 or more ribs are broken in at least 2 places, the injured portion of the chest wall does not move with the rest of the chest. That's an indication of a pretty significant chest injury. A flail chest decreases the amount of oxygen and carbon dioxide exchanged in the lungs, which is the reason why it's important to find out when this happens and treat it really quickly. Do not restrict movement of the chest if the patient's having difficulty breathing, but it may be super helpful to support the patient's breathing with some positive pressure using a bag valve mask and supplemental oxygen. Monitor the patients and support the patient's ABCs and arrange for prompt transport. Penetrating chest wounds. If an object penetrates the chest wall and air and blood escaped into the space between the lungs and the chest wall, this is a penetrating chest wound. Air and blood may cause the lung to actually collapse, really affecting the body's ability to bring oxygen in. Blood loss into the chest cavity can produce shock. We can quickly close these wounds with an occlusive dressing. Occlusive dressings will be anything that you can seal off that chest wound with. Administer oxygen whenever you can, and if a knife or other object is impaled in the chest, don't take it out. And arrange for prompt transport. Summary. Musculoskeletal injuries are caused by 3 types of mechanism: direct, indirect, and twisting. Fractures can be closed with the bone broken but there's no break in the skin, or open when the bone is broken and overlying skin is lacerated. A dislocation is a disruption that tears the supporting ligament of the joint. A sprain is a joint injury caused by excessive stretching of the supporting ligaments. There's a couple of different basic types of splints that can be helpful for this. Things like rigid, soft, and traction splints. In a closed head injury, bleeding and swelling within the skull may increase pressure on the brain, leading to irreversible brain damage. An open injury to the head is something that tends to bleed pretty profusely. Airway obstruction is the primary danger in severe facial injuries. When you suspect a spinal injury, do not move the patient during the examination. Most common chest injuries are rib fractures, flail chests, and penetrating chest wounds. This is a quick rundown on some of these injuries you may come across. Should you have any questions, reach out to your primary coordinator. And we appreciate your time, your patience, your energy, and as always, we look forward to seeing you at our next discussion. Have a great day.